you. I think this is for Minister Freeland, likely. Those conversations that you had, I'm just wondering what discussions were had about possible border measures at the Canada-U.S. border. Is there any possibility of the border being shut down or of certain border crossings being shut down if certain airports are being restricted?
When it comes to the Canada-U.S. border, what was reaffirmed in all of the discussions all of us had with our American counterparts on both sides of the conversation was how important that border is for both of our countries, for human reasons, for economic reasons. 400,000 people cross that border every day. It's an essential part of the life of all of very many Canadians and very many Americans, and we affirmed that. Now, we have received today public health advice around all international travel, all travel outside of Canada by Canadians, and I think that all of us in Canada need to listen very carefully to that public health advice. You guys heard it just a few minutes ago. The advice is, that we should, all of us, avoid non-essential travel outside of Canada.
Well, thank you, and I think it's an excellent question. I think what we have to remember is that viruses don't know borders. A border is not going to contain the virus. The borders are important measures, though, for making sure that people have information about what to do when they're in a particular country, should they find themselves ill. In our case, the information we've been providing since we first became aware of the illness was information about what local public health numbers are available in various jurisdictions, so that no matter who is traveling, regardless of whether it's domestic travel or international travel, they have appropriate information to reach out to public health officials. It's really important to remember this, because I think Canadians think that we can stop this at the border, but what we see is a global pandemic, meaning that border measures actually are highly ineffective and in some cases can create harm. And we see that in some of the countries that have the worst expression, who had the tightest borders. If I point to our dear friends in Italy, in fact, they had, as you recall, some very early restrictions on international travel, in fact, shutting down borders. And what they found was an escalation of cases because, of course, borders don't stop travelers. And travelers find other ways into countries, and travelers become less honest about where they've come from, where they're traveling to, what their particular symptoms may be. And so Canada's approach from the very beginning has been to use science and evidence to make these decisions to keep Canadians safe. The reason why we took the measures early on was because the science says that when you provide the screening and the information at the border, especially as you understand how the pandemic is traveling across the globe, you can actually have those conversations with travelers. You can actually follow those travelers depending on the severity of the illness in their particular country, which we have been doing with public health at local public health levels. You can track and actually even consider, and we have, adding mandatory isolation. And that allows you to contain the spread within your country. Now that we see cases in Canada, borders become less important. And the relationship with the United States is going to be critically important so that we can continue that work together. Because we have people with coronavirus in the United States, and we have people with coronavirus in Canada, and undoubtedly we have people with coronavirus in Mexico. And so those conversations as a continent are going to be what continues to keep us safe. Thank you.
Okay, and as a follow-up, I think this is for perhaps Minister Blair or Minister Garneau. I wonder if we could get a little more detail about the screening that will happen at airports for arrivals. What will that screening entail? Will it be for all international travelers, and would that also apply to land border crossings with the U.S.?
Yes, as I've indicated, we have quite recently implemented enhanced screening measures at all land, rail, and marine points of entry, which of course are primarily coming from the United States, not exclusively, but primarily. We focus our resources particularly at people who are traveling from high-risk regions, those which have been identified by our public health officials as tier level 3 or tier 3 regions where there's a higher risk of infection in those regions. And for all international travelers, they are subject to screening. If, for example, they have been to one of those high-risk areas, they receive certain information, and if they are in need of of further interaction with our public health officials, the referral takes place right at the airport. We also provide those international travelers with additional information should they become symptomatic or feel ill, and they get public health advice at point of entry. I think that's very, very important. And for those individuals as well who may be symptomatic, there's an immediate referral to public health authorities so that they may begin the important process of self-isolation or quarantine as required. And so those steps are being taken. And there's a very close coordination taking place today at all of our points of entry, particularly the international ones from affected regions, between our border service agents and public health. And they're in constant communication. A very important part of our responsibility there is screening for those who are at risk, but it's also informational, as the health minister said, providing people with information so that they can take the right steps to keep themselves and their families and their neighbors safe when they return to this country. And at the same time, as we've heard from the public health officials today, Dr. Tam, we are advising people to avoid all unnecessary travel, and particularly to international destinations. And I think it is important to advise not only Canadians as they travel abroad, but for others who would choose to come to Canada, that they avoid unnecessary travel, non-essential travel to this country. And if they do have to come here, they will be subject to significantly enhanced screening. We're consulting with stakeholders and with our authorities across the country, looking at ways in which we can manage this in the most efficient way possible. We know the important work that public health officials are conducting for Canadians right across the country, and we also know that our border security officers, I believe, are doing an outstanding job in providing those services and protecting the best interest of Canadians. We want to make sure that we utilize those resources most efficiently and most effectively for the safety of Canadians.
I'm going to actually ask a question. That was one of the conditions that I put on the table to moderate the press conference today. Dr. New, my question is actually for you. I'm just wondering if you can speak in a little bit, or actually in much detail, about what social distancing looks like, because even among friends and family, I think the whole notion is creating a lot of anxiety for people about, you guys are all kind of huddled on the stage here. Are you? So can you describe?
Two arm lengths.
Yeah. So should people be going to social gatherings? Can you just offer us some concrete, and Canadians some concrete guidance on what social distancing should look like? I know no big parties, but what about smaller gatherings of family? People are really wondering about this.
Okay, so going back to the science, the idea behind social distancing and sort of this 2-meter rule is because we know that the main mode of transmission of the virus is through droplets. And if someone is sick and coughing, about the farthest, they can cough and have a droplet sort of land on the ground or hopefully not hit someone is about up to 2 meters. And so I think the easy way we've explained it, and other authorities across the country, is sort of 2 arm lengths. So that's about 2 meters. And so if people can sort of, still get together, but maintain that sort of general distance and not be sort of within hugging distance, then I think that's what social distancing is all about. And I think that's why also many public health authorities are also recommending no mass gathering events. And, the number itself, I think, is not that critical. 250 has been put forward, and I think that's reasonable. I think it's just the principle of reinforcing with people that, obviously the government can do what it can in terms of being prescriptive in certain ways, mass gathering events, saying that you cannot hold them. But I think, as you say, common sense for many people, the types of small parties people will have, if you just maintain that as sort of a general rule, and as we said before, maybe no handshakes or hugging or kissing, but maybe just the elbow bump, that I think would be a good way to go forward. And of course, as we said many times before, we can't repeat enough times, wash your hands frequently. If you do become ill, don't go to the party, stay at home, don't go to work, and good cough etiquette. So those things still stand.
And I do have a kind of technical question, and I apologize. I know in public health you normally don't talk about individuals and have their names. Of course, in this case, we are talking about Sophie Gregoire Trudeau, because that's been made public that she's tested positive. Mm-hmm. She recently was traveling internationally. She had flown to London. She was with the Prime Minister's mother, Margaret Trudeau. Typically, Health Minister Haidu, in the past you've talked about public health working with the airlines and providing the manifest and contacting people who may have been around a passenger who was later identified to have COVID-19. again, sorry for the personal nature of this question because we know who it is, but is that work underway to try and let other passengers on the flight that she was on know that she indeed tested positive? And also if Margaret Trudeau is in self-isolation as well, if we know about that.
So I think I'll say a few words and then I'll turn it over to Dr. New. But first of all, there is no evidence that someone needs to self-isolate if in fact they have been in contact with someone who is asymptomatic. And so it's important to remember that. That is why the Prime Minister has received that public health advice that he doesn't have to have a test. He is, of course, self-isolating out of a degree of precaution because he has had a close contact with someone who's positive. But should he remain asymptomatic for 14 days, then he will be considered to not have the COVID-19 disease. As well, yes, the description that you're providing is actually what contact tracing looks like. So now, what will happen with a positive case, and given that our cases are still so low in this country, we still have the public health capacity to do this work. This is also important to remember. Now, public health will do the contact tracing for Madame Gregoire Trudeau. They will extensively interview her about who she's been in contact with and who she's spoken with, as well as secure the manifest of the plane to talk to people that were within that 2-meter radius of her, to determine if they are feeling symptomatic and to ask them to take appropriate precautions around self-isolation. And I will turn it to Dr. New if you want to add anything.
I think you said it very well, Minister. Obviously, I don't know the details. We're leaving that to local public health authorities to do that very detailed contact tracing, obviously starting with their interview with the Prime Minister's wife. And so the key point will be to determine who she's been in contact with after she began symptoms. So to me, it's not clear. I don't know personally as to when she began to feel ill. Was it on the flight or was it afterwards? If it was really after the flight, then really the people who are around her on that flight would not be considered at risk. If it was becoming ill on the flight, then obviously the steps would be taken as we've done for other cases. It has been, I think, a point of discussion with the Special Advisory Committee, the usefulness, because to date, no cases have been sort of further detected through what we call airplane contact tracing. And so in terms of public health resources, in terms of what is the best use of public health resources, a very focused sort of contact tracing on airplanes versus lots of other things they could or should be doing. That's still something where we're looking at. Obviously, we're looking at the evidence based on the cases we've had so far, and then we'll obviously put our best foot forward and advice in terms of what we should be doing for future cases that might have that sort of air flight component.
Thank you. I'll go to Raymond.